Hello, I'm R. Kishore Kanna, Assistant Professor, Department of Biomedical Engineering, School of Bioengineering, BIST from Bharat Institute of Higher Education and Research. In this video, I'm going to give lecture on endoscopy and its application from the course name called Medical Instrumentation 2. Endoscopy is a methodology which is used to view the internal structure of human body without any cutting or coagulation process or without any surgical procedure. It has been widely used for viewing the internal architecture or internal physiology parts of human body which has not been visible without any invasive methodology is being carried out. This endoscopy is being helping the doctors and physician to view the internal section of human body without any cut and coagulation. That is the major and ultimate function of endoscopy. And endoscopy is being used to find the blocks and to find the internal disease or defect or injuries through the endoscopy tube and to the through by the camera which is being used for viewing the internal physiology of human body. Endoscopy is a non-surgical procedure used to examine a person's digestive tract by sleep. Nowadays, endoscopy is being widely used for all application, but endoscopy is being proposed for mainly for examining or viewing the internal architecture of human body's digestive tract. Using an endoscope, a flexible tube with a light, a tube which is being made up of a flexible material will be attached with small LED light will be mounted on its top with a light and camera attached to it. A flexible tube which is being mounted with light will be having a camera head on its top, and to a doctor can view the internal architecture of your digestive tract on the monitor outside without performing any surgery process. Unlike many other medical imaging techniques, endoscope are inserted directly into the organ. That means in medical imaging techniques and applications, people will be people will be extracting the image like CT, MRI, PET, SPECT. People will be extracting the image without inserting. But in endoscopy, directly doctors will be inserting the camera mounted light with a flexible tube will be inserted into human body, and the internal physiology will be directly captured through that camera. This is known as endoscopy. Principle of endoscopy. Ultimate working principle of endoscopy is endoscopes are widely made up of fiber optics, which will be made up of thin glass fiber materials to transmit the light from one point to another, which captures the internal organ which is being viewed inside by the camera from inside to outside to the monitor. These fibers uses the principle of total internal reflection to transmit almost 100% of light entering from one end to another end. The image which is being captured by the camera will be completely extracted by using this fiber optics application in the endoscope, and that image, that data which is being captured will be sent to the monitor to view the internal organ structure by the doctor. This is the working principle of endoscope. Construction. How the endoscope is being constructed, how wisely it is being developed as a equipment for viewing the internal organ physiology, human anatomy physiology by the pictures. Actually, endoscopy does not comes under the medical imaging technique. it comes under the medical instrumentation because of the result which is being captured will not be captured or recorded non-invasively. It is being sent inside the human body, so it comes under the invasive methodology. So it doesn't go for digital medical imaging techniques. It comes under the application of medical instrumentation. An endoscope, which can consist of a rigid or a flexible tube, which is being made up of flexible material. Mostly fiber optic material will be the material used to make the flexible tubes, which can easily change its structure and shapes according to the movement of wire by the doctor to view the internal organ of the human body. A light delivery system, a light which is being mounted above the camera, is known as light delivery system to eliminate the organ or object under the inspection. The internal viewing will be clear when the light is being penetrated on it in the internal structure. The light source is normally outside the body and the light is typically directed via optical fiber system. A light which is being transmitted inside is being regulated by the source which is outside the human body. From the outside source, light will be given to the mounted endoscope which is being inserted inside through the fiber optics they are saying. Why the endoscopy is being made up of fiber optics means the material which will be lighter, which will be flexible, which has the ability to change its structure according to the need and demand of the or internal organ architecture. For that purpose, fiber optics is being material is being made for making the endoscopy. The light source is normally outside the body and the light is typically directed via an optical fiber system. Why it is known as optical fiber system means it carries a light rays from outside to the inside. So it is being considered as optical fiber system. A lens system transmitting the image from the objective of lens to the viewer. A system called lens system is there that will be capturing the data. That data which is being captured will be sent as an image or a video to the viewer who is been watching it the monitor. Typically a relay lens system in the case of rigid endoscope or a bundle fiber optics in the case of fiber scope. For conveying the image which is being captured to internal organ to external source called monitor, they are using the fiber optics application, fiber optic rigid endoscope materials for capturing the image and displaying it in the display. This is known as fiber scope. Fiber material which is being used in the endoscope is being considered as fiber scope, and that will be considered as a eyepiece which is being watching and capturing the data inside the internal organ. So it is known as eyepiece. A modern instrument may be a video scopes with no eyepiece. A camera transmit image to the screen of the image captured. This is the advancement. Initial endoscopy was being the fiber optics. After the recent advancement and development in the technology happening, directly BJ camera or 2 to 5 megapixel secret cameras are being placed and it is being inserted into the human body, and it doesn't have any kind of non-toxic, or it doesn't have any matching problem with the immune system. So it doesn't have any complexity for placing a camera into the human body. So same fiber scope will be used, but a camera which records the live recording of the internal image is being placed after the advancement in the technology. And modern instrument may be video scope with no eyepiece. A camera transmits the image to screen for the image capture and additional channel to allow entry of medical instrument or manipulate. When there is advancement, there will be changes in the technologies. Nowadays people are capturing while it is being capturing the data itself, here in monitor externally, doctor will be visible with the internal organ architecture. So this is the advancement which has been made in the endoscope, and it will be much helpful for the doctor for quick diagnosis and for applying quick therapeutic therapeutic process. So this is the construction of endoscope, which has been developed to view the internal organ directly without any surgery. And these are the parts of endoscope. This is known as insertion tube, and this is known as a probe. We will be calling it handpiece. We will be controlling this probe with this handpiece for capturing the data from internal organ to the monitor, and this umbilical cord will be sent inside. This from this point to this point will be sent inside. This umbilical cord will be connecting the handpiece as well as the internal architecture of the or internal weaving of the human body will be captured by using this umbilical cord, and this will be having suction pump. Sometimes while we are letting the endoscope, patient will be mm, feeling vomiting sensation, or it will be against their body circulation or body movement. That time some kind of fluid can occur, which can which can make the camera to be blur. To avoid that kind of situation, this suction pump has been used, and pressure gauge will be there to adjust the pressure inside the human body, and an air pump and inflation connector will be there, which does not affect the inhale exhale process of the human, and there will be a probe like structure, and it will be carrying a light guide connector where light will be mounted inside the tip. The camera will be placed. That camera will be capturing the internal structure of human body. Once the camera is being captured, it will be storing as image. The data will be collected and that will be stored as image through the fiber optics application. It will be transmitted to the computer, and computer will be capturing the data, and doctors will be using that image for analysis. So these are the parts of endoscope which is being used to capture the internal architecture of human body. Endoscope also have a channel through which surgeon can manipulate tiny instruments such as forceps, surgical scissor, and suction device. That means endoscope will be having a separate channel barrier where people can proceed with the surgical instrument. Nowadays, by using the endoscope component, people are doing the surgery with the help of endoscopy. So endosurgery is being developed in all countries, and without any cutting or coagulating, endosurgery is being done, and endoscopy is being widely used in ENT departments, um, to weave the internal structure of ears, to weave the internal structure of mouth wall. For every internal view structure, people are using endoscopy. So surgeons are using endoscopy for surgery without any cut or coagulating in external surface of human body. Variety of instrument can be fitted to the endoscope for the different purpose according to the need and according to the purpose demanded for the patient. The surgery will be varying the assay. A surgeon introduces the endoscope into a body either through body opening such as mouth or anus through a small incision of skin. Mostly it will be inserted throughout the mouth. If you want to find the real image or internal image of intestine or abdomen, people will be inserting the endoscope through the anus, and it is not being recommended for all age category patients. People with real need and risk for the providing the treatment will be going for the insertion of anus through the endoscope through the anus. And this is known as esophagus gastroendoscopy, where the intestine part and stomach part will be captured by using the endoscopy. And see, through the mouth opening, endoscopy tube is being fiber optic tube is being inserted in the abdomen part of the stomach. Some kind of biopsy is being done, and internal organ is being captured by using the light which is been mounted through the fiber optics tube, and there will be a camera which will be will be capturing the internal structure, and it will be transmitting it to the monitor. Biopsy, autopsy are being done through this esophagogastrostomy endoscopy, and it is otherwise known as upper endoscopy. Upper endoscopy means inserting the endoscopy wire through the mouth opening is known as upper endoscopy. Okay, this is the insertion part. Okay, a tube which is being carrying the lens, light, air water nozzle, and opening of biopsy channel. And AA will be will be termed as image guide lens, lens of a camera which will be capturing the internal image with quality, with the higher pixel for clear viewing. And BB will be the light guided lens which will be guiding the lens to capture the perfect part or perfectly capturing the internal organ structure without any shakes or without any miscollision. And CC is known as air water nozzle, where sometimes air exchange, gas exchange, or water is being needed to the human during the endoscopy, means they will be conveying through the CC opening. And DD is for biopsy channel, which will be recording the captured image data, and it will be conveying the captured data to the server or to the display, where the surgeons and doctors will be viewing the internal section of human body. This is known as distal tip on insertion tube. Distal tip of insertion tube. And this is known as channel system, which will be placed in external surface. Fiber optics tube which is being inserted is known as internal surface. For capturing internal structure, there are a lot of setup will be made in external surface of human body. There will be a light source. This light source will be emitting a light for the through the fiber optic material to view the internal architecture clearly. And this light source connector will be connecting it to the fiber optic tube which is being inserted in the human body. And there will be a gas adapter where that water and gas exchange will be proceeded through the fiber optic line. And there will be a video processor which will be processing the collected image data as a video, and it will be displaying it in a monitor. So this is a setup where air, water, suction channel system will be working parallelly to capture the internal architecture or internal surface of the human body by endoscopy. Functions: to view the internal part of using the lighting system, camera, and video, and use it for a medical instrument to remove unwanted cancer. Endoscopy not only is used as a imaging instrument, it is also used as a medical instrument to remove unwanted parts or infected parts from the human body without any surgery. Proceeding surgery with endoscopy without any surgery procedure. That means without any cut or coagulation in human body, through inserting the endoscope, inserting the surgery knife, cutting the cancer cell or cutting the infected cell and removing it from human body This is known as endosurgery. This has been widely used, and this is why it is being widely used, because it reduces the risk of surgery for the patients, first thing. And second thing, healing time period is been less when it has been compared with surgery. And third thing, no cut or coagulation, no blood loss can occur when the surgery is being done by endoscopy. So endoscopy is used for both medical imaging processing and medical surgery process. So endoscopy is a vital key in a modern day for a healthcare domain for proceeding the medical imaging as well as the surgery. Blood loss, blood saver surgery. It has been termed as a blood saver surgery in Britain, and most probably people with tuberculosis will be will be handling this endoscopy surgery by removing the TB infected part from the lungs, or uh, through the to the nearer part of lungs will be removed by using this endoscopy surgery. And widely used for cancer cell removal, this endoscope surgery is being done. Enters through the opening in the body, and that surgery or endoscopy imaging capturing will be lasting for 15 to 16 minutes, where the patient will be bearing some sort of pain, some sort of vomit sensation will be there. These are the disadvantage, but advantages being more when it is being compared with disadvantages. Limitations. Now we are going to see about what is a limitation for performing the endoscope. Compared with other parts of digestive tract, the small intestine is difficult for doctor to access. You can view the internal structure of all digestive tract, but the small intestine, which is been in the grounder part of the human anatomy, it is difficult to access or difficult to view for the doctor as an internal structure. While a camera tipped tube slipped down through the throat can get an image of stomach, and a tube inserted at other end track reveals the large intestine, no such device reaches into the most of the small intestine. So doctors really externally generated image. They are saying that you it is very hard and complex to capture the small intestine part area. But by using the endoscopy, you can easily insert a fiber optic material tube with the camera mounted light will be inserted through the mouth openings and directly capture the image of internal organ of a small intestine without any surgical procedure. This is a very highly appreciable methodology to capture the small intestine's internal organ image. And capturing the small intestine internal organ imaging is very hard and complex. After the endoscope arrival, it has been made easy, and it has been made very simple to doctor to diagnose any defects happen in small intestine and large intestine. Risks, and these are the risks will be happening for overtaking or for undertaking the endoscopy surgery or endoscopy methodology for viewing the internal organ structure. Main risks are infection. Why? Because it is invasive. We are inserting a material, a fiber optic material or fiber material material to the human body, which is invasive. So it should be it should be held very safe region or hygienic place. Infectious factor are more while performing the endoscopy process. So main risks are infection, over sedation. While the endoscopy is being done, patient can't bear that pain. They will be feeling vomit sensation. So sedation will be given. Sometimes over sedation has been given means it can also collapse the human body. Perforation on tier of stomach of esophagus, internal lining or internal bleeding due to improper handling of endoscopy, internal injury can happen. That all comes under the risk. Although the perforation is generally requires surgery, certain cases may be treated with antibiotics and intravenous fluid. Although some internal injury may happen while during the endoscopy, when it is being compared with surgical procedure, it is okay that to take this kind of risk to find the internal architecture or internal structure of human organ. Occasionally, the site of sedative injection may become inflamed and tender for a short time. This is not serious and warm comprehensive for few days for usually helpful. A sedation can which is being given to the patient while performing the endoscopy can have its effect for few days, which can be felt by the patient for a few days, which makes the patient slightly uneasier. When it is being compared with the surgery procedure, it is okay to take this risk to perform the endoscopy. Medical uses. What are the medical uses? Is investigation of symptoms like nausea, vomiting, abdominal pain, difficulty swallowing, bleeding, confusion of diagnosis, anemia, bleeding, inflammation, cancer of digestive system, and giving treatment. These are the medical usage limitations which will be happening, which will be faced by the patient while doing the endoscopy. These are the actual limitation while the using the endoscopy as a medical uses, but we have to overcome this while performing the surgery. That will be a more drawback for the patient, so we have to overcome this limitation and risk to perform the endoscopy surgery or endoscopy imaging methodology to view the internal organ. Recent trends are endoscopy, virtual reality simulators, disposable endoscopy, capsule endoscopy, augmented reality. Endoscopy VR virtual reality stimulator is before handling with the endoscopy, doctors which are being trained to be doctors, they will be given with the endoscopy via stimulators, which is been completely comes under the artificial intelligence application. They will be trained with that VR stimulator, and they will be trained means they will be properly learning how to handle the patient without having a first try directly with patient. They will be handling, they will be trained. After trained, they will be coming for real-time endoscopy that may not affect the patient when they proceed with endoscopy with real-time patients. And disposable endoscopy is once a endoscopy tube is being captured the data, it should not be nowadays. Every material is being comes under the disposable category only. Now once the endoscopy captures the image or surgery is being done, it will be considered as a medical waste. It will be removed and another endoscope tube will be connected to the channel for the another patient's recording. So disposable endoscopy also is a recent advancement in biomedical application. And capsule endoscopy. Capsule endoscopy means a camera with light and recorder will be sent through the capsule. A capsule will be gone into the small intestine and it will be capturing the whole internal organ. Whole internal organ will be captured and it will be excreted through the excretion system of the human body. What is the advantage of capsule endoscopy? No need of sedation, no need of insertion of wire. Without sedation and insertion of wire, all internal organs is being captured by that capsule endoscopy. This is real benefit will be goes to the patient. They doesn't have any complexity while performing this kind of endoscopy capturing in real time. And augmented reality is the next recent trend, which is it to have its impact in medical industries as well as healthcare industries, and it is in developing condition in developed countries. And it when it is been having its impact, it will be improving its healthcare quality to the next level. Types of endoscopy existing is gastroendoscopy, colonoscopy, laparoscopy, proctoscopy, cystoscopy, bronchoscopy, laryngoscopy, and gastroscopy. Future. What is the exact future of endoscopy is video capsule endoscopy. I already explained what is video capsule endoscopy. A capsule which will be capturing the internal image as a video or image without any sedation, without any insertion. All internal image will be captured. And video capsule endoscopy, suspected blood indicator and quick view of virtual chromoendoscopy, 3D construction software are being in the developing condition, and remote manipulation to capture what are the views, what are the angles, what are the location of internal structure will be captured by using the video capsule endoscopy. These are the futures and advancement is being expected in endoscopy. So this is known as the working principle of endoscopy. I have explained what is the aim, what are the types, what are the components, what is the method, what is the procedure, what is the risk, what is the advantage, and what is the disadvantage, what is the limitation. Now I have been ending this content with the future of endoscopy. Thank you.